Hi everyone, this is Dr. Shalini Gupta at the Dermatology Laser and Vein Center, and we hope that you are all staying very safe and healthy at home during this COVID-19 pandemic that we're experiencing. So we thought we were here at the office, and why not share some insight into some of the procedures that we do, and you can get some education on your downtime at home. So one of the really popular procedures we're doing right now is called Emsculpt. And as you're sitting at home, I hope that everyone is doing a little bit of exercising and taking really good care of themselves, eating healthy and staying up to date with their daily routines at home. But of course, when you are ready and when we reopen, you can come and get Emsculpt from us. And what Emsculpt does is it kills fat cells, but it also builds muscle. And so it's a really unique technology because unlike the other procedures we have for fat loss, those procedures work directly on the fat cells. So Emsculpt actually does not work directly on the fat cells, it works on the muscle. So it causes a contraction of the muscle, but it's not like your flex belt where you get one contraction at a time. The Emsculpt actually creates a flutter of really high intensity contractions in a row, and it overwhelms the fat cells and causes them to actually die off. So this is something nobody can achieve on their own with exercises or even with a bunch of crunches. So for example, when you have an Emsculpt procedure, it's like doing 20,000 crunches in 30 minutes. That's incredible. Emsculpt can also be used for the buttock area where it will give a nice butt lift. You can also use it on the arms and the thighs, and also women who've had children and even men where the muscle separates. It has been clinically shown to bring that muscle back together, along with, of course, giving you better tone, posture, and getting rid of that pudgy, stubborn fat as well. The Emsculpt procedure can also be used for men and women to help with urinary incontinence and erectile dysfunction. So that's another very interesting aspect of this technology. So let me show you a few before and after photos of the Emsculpt procedure. These are some patients in our office who had the treatment, and hopefully you can see it on the screen there. This is a before side view and a frontal side view, and you can see a noticeable reduction in fat volume and also an improvement, interestingly, in the love handles. Though the paddles were applied to the stomach specifically, the contraction occurs throughout the torso, so you get a really overall core reduction in size. Here's another gentleman who works out regularly, had sort of a six-pack you could see, but then we took him from this to a very visible and pronounced 8-pack, and he got rid of that pudgy fat finally that he was struggling with to get rid of at the gym. This is a female patient who had the Emsculpt procedure, and this is her before and her after image. And this is a side view of, again, take a look at the stomach, take a look at the love handles, and see what happens. And this is only 3 months out after the treatment. The results are maintained. This is for the buttock lift. Again, a nice increase in volume, shape, and a lift to the buttock area. So the fat loss from the Emsculpt procedure is actually permanent. So once you lose that fat, it is generally not going to come back unless, of course, you choose a poor lifestyle afterwards. The muscle tone you have to maintain, so we always encourage patients to exercise and work out because that you need to do anyway for your overall health, for your cardiovascular system. But the Emsculpt, like I said, will actively work on one area where you want to tone up the muscle and you want to get rid of fat at the same time, which you cannot achieve with exercise, or you have tried but are unable to achieve. So for the muscle maintenance, you can come in periodically, and we do offer packages. It's sort of like a gym membership. So you can come in and get an Emsculpt treatment periodically to maintain the muscle mass. So that's it about the Emsculpt. I hope that was educational. Give us a call. We're happy to do virtual consultations with you for the time that we are not able to see patients in the office. And you have a wonderful day. Thank you.